For the record, my name is Senator Ben Brown from the 26th District, and I'd like to thank the committee for the opportunity to present Senate Bill 897, legislation designed to reform the burdensome and often inefficient prior authorization process within our healthcare system. We all recognize that prior authorization was initially intended as a cost control measure, a way to prevent unnecessary procedures and reduce waste. However, over time, it has morphed into a significant administrative obstacle, delaying critical medical treatment, overburdening physicians, harming patient outcomes, and driving up the cost of healthcare. In fact, in 2024, Chair Crawford held a special committee meeting with the purpose of investigating the causes contributing to the rising price of healthcare. A variety of experts in the field came to testify, and the one common refrain that we heard was the impact that the burdensome prior authorization process had in regards to driving up prices. According to a survey by the American Medical Association, 35% of physicians have to hire staff just to work exclusively on prior authorizations. MU Healthcare staffs approximately 60 people just for this purpose. At BJC, it's over 100. Another implication of the current system is that a hospital will begin prepping for a procedure only for a prior authorization to be denied. Despite not being able to proceed, the costs of that prep are still incurred, resulting in further increases to healthcare costs. Senate Bill 897 introduced a balanced, common sense approach by implementing a gold carding program that rewards high-performing healthcare providers with fewer administrative hurdles. Under this bill, any provider who's had at least 90% of their prior authorization requests approved within a 12-month evaluation period would be granted a gold status, meaning they will be exempt from prior authorization requirements as long as those high standards are maintained. Physicians and healthcare professionals should spend their time where they're needed most, with their patients. Yet today they are forced to dedicate countless hours each week to submitting prior authorization requests, navigating appeals, and dealing with insurance denials. According to the AMA, nearly 9 out of 10 physicians, 89%, reported that prior authorization had a negative impact on patient clinical outcomes. Also, 94% reported that prior authorization delayed access to necessary care. SB 897 cuts through that red tape. By establishing a gold carding system, this bill ensures that providers with a proven track record of medical necessity no longer to have to go through that repetitive, burdensome approval process. I understand that some may have concerns that reducing prior authorization requirements could lead to overuse of medical services. However, this bill includes critical safeguards to prevent this. The 90% approval rate threshold ensures that only providers who consistently demonstrate sound medical judgment receive gold card status, and include a look-back provision so that insurance companies can ensure continual compliance. Insurers will still have oversight and can revoke gold card status if a provider commits fraud or no longer meets the required standards. Insurers can institute a 6-month look-back review up to twice per year and rescind the gold card status if during that look-back period the provider would have fallen below that 90% threshold. What this legislation does not do is allow providers to bill for services outside the scope of their license or misrepresent claims, maintaining integrity and accountability in the system. Senate Bill 897 does not eliminate necessary oversight, it refines it, ensuring that prior authorization is applied only where it is truly needed, rather than creating unnecessary barriers to patient care. At its core, Senate Bill 897 is about striking the right balance between necessary oversight and unnecessary bureaucracy. It ensures that medical professionals who have already demonstrated responsible decision-making are not forced to jump through hoops that serve no real purpose. It empowers providers, improves patient outcomes, and ensures that administrative process support rather than hinder quality health care. By passing this legislation, we take a significant step towards a more efficient, patient-focused healthcare system in Missouri. I urge this committee to advance Senate Bill 897 and bring much-needed relief to our healthcare providers and the patients who depend on them. Thank you, and I'd be happy to answer any questions.